This video is intended only for healthcare professionals in the US and is intended to be viewed in its entirety as it was originally produced by Pfizer. An overview of post-COVID conditions or long COVID. Post-COVID conditions, or PCC, are referred to by many names, including long COVID, long-haul COVID, post-acute COVID-19, long-term effects of COVID, chronic COVID, and post-acute sequelae of SARS-CoV-2 infection. Inconsistency in names and definitions of post-COVID conditions make assimilation and comparison of findings from studies challenging. The Centers for Disease Control and Prevention and U.S. Department of Health and Human Services define post-COVID conditions as signs, symptoms, and conditions that may be new or ongoing 4 weeks or more after the initial phase of SARS-CoV-2 infection. The World Health Organization uses a different definition. According to the WHO, post-COVID-19 condition occurs 3 months from the onset of COVID-19, with symptoms lasting for at least 2 months, with no alternative medical diagnosis. PCC symptoms are variable in their presentation and impact. There is no minimum number of symptoms required for diagnosis, and symptoms may persist for weeks, months, or even years after acute SARS-CoV-2 infection. Prevalence and risk factors. Millions of people in the U.S. can suffer from post-COVID conditions, though prevalence may be underestimated. According to the National Center for Health Statistics U.S. Census Bureau Household Pulse online survey, as of July 2023, 28.1% of adults who have had COVID-19 experience post-COVID conditions, leading to an overall prevalence of 15.4% of all adults in the U.S. Several risk factors for post-COVID conditions have been identified. These risk factors include being unvaccinated for COVID-19, experiencing more severe acute COVID-19 illness, the presence of underlying health conditions, older age, female sex, identifying with certain ethnic minority groups, and lower socioeconomic status. Pathophysiology. The exact etiology of post-COVID conditions is not known, but leading hypotheses include viral persistence, autoimmunity triggered by SARS-CoV-2 infection, reactivation of latent viruses, and inflammation-triggered chronic changes. Proposed mechanisms include a combination of immune dysregulation, microbiota disruption, autoimmunity, clotting and endothelial abnormalities, and dysfunctional neurological signaling. Presentation and burden. Post-COVID conditions are diverse in presentation, affecting multiple organ systems. Pulmonary conditions, such as acute pulmonary embolism and respiratory symptoms, are the most common presentation among adults in the U.S. Other commonly self-reported symptoms include fatigue, perceived cognitive deficits, and myalgias. Symptoms may persist from the time of acute COVID-19, present with a relapsing remitting pattern, and/or worsen over time. Those living with post-COVID conditions may experience significant morbidity. According to a U.S.-based multi-center prospective cohort study, patients with post-COVID conditions reported poorer long-term overall health status and quality of life and increased psychological distress. Post-COVID conditions may cause disruptions in work life. According to a systematic review and meta-analysis including patients around the world, many adults with post-COVID conditions reported an inability to return to work due to functional impairment as well as disruptions in their work life. Currently, there are no therapeutics approved for the prevention or treatment of post-COVID conditions. Management of post-COVID conditions aims to optimize function and quality of life in patients. Follow-up visits with a healthcare professional may be considered, with frequency tailored to the patient's condition and illness progression. Continuity of care is important in the management of post-COVID conditions. Post-COVID conditions are diverse signs, symptoms, and conditions that occur after an initial SARS-CoV-2 infection in some patients. Scientific knowledge about post-COVID conditions is still limited. Further research is needed to understand the pathogenesis and improve diagnosis and treatment of post-COVID conditions.